Hello everyone, let's try to solve this question together. So here we have a 4-week-old preterm infant. The gestational age was 25 weeks. So infant currently is 29 weeks. So weekly labs are drawn. The vitamin D level is 17, which is one down from the last week, which was 18, as shown in the chart here. Let me show it to you. So here on 112 it was 18 and now it's 17. So the infant is receiving multivitamin with iron, the standard formulation. The best next step in the management is, what do you guys think is the right choice here? Okay, the right choice here is continue with 24 calorie formula. The reason is, which is, if you guys can look at here, is that this is the key word here, multivitamin standard formulation. If you guys remember, the standard formulation for neonates contains 400 international unit of vitamin D. So just remember that standard formulation contains 400 international unit of vitamin D. So that is vitamin D. So that's why the infant is getting the required amount, and of course this infant is still young, it's 4-week-old. The other clue is, look at the calcium, which is okay. The phos is actually on the higher side, which is reassuring. The mag looks okay, and alkaline phosphatase is within normal limit, is less than 500. So having a normal phos, having a normal alkaline phos, and a normal calcium does not really mandate that you go ahead and start the baby on calciferol. Although this is not a bad option, because in European studies, they go for the higher amount of vitamin D supplementation, which I will show you in next slides. So now let's see why the others are wrong too. So again, we said that we'll talk about the extra supplement later. So long-term bone x-ray, this infant is 4-week-old. Labs are really reassuring. So there is no need to obtain long bone x-ray. Same thing with PTH. This is not needed now. If you have high alkaline phos and low phosphate, then of course you want to do the PTH, or other way around. If you have a very high phos and calcium is low, then you want to do the PTH, because there are many PTH problems that can give to calcium, phos, mag, and alk phos variability. There is hyperparathyroidism, hypoparathyroidism, pseudo hypoparathyroidism, you name it. So but here that's not the case, so you can easily eliminate that. So now let's go and talk about the two extremes, or not extremes, the two-way. So this is a study comparing two doses of vitamin D. One is 500, the other one is 800 to 1000, and you see that they said that supplementation with higher amount should be done, but monitoring is advised, that you should monitor and then see that if there are no side effects of it. This is the American Academy of Pediatrics, and here also it's some systemic review and meta-analysis, as the title says. So as you guys can see here, that they compare 800 to 1600 with 400 daily supplementation, and the basic inference was that there were no effects on the mortality, morbidity, on growth with either two groups. So it doesn't make a difference if you use a high dose or a low dose. And also they said that there is no effect seen on the calcium, phos, and alkaline phos. The point is, what you are achieving with higher dose, basically a sense of reassurance. Otherwise it has no difference in terms of long-term outcome or short-term laboratory outcome. But again, like I said, there is always a choice if you want to go ahead and use more, especially when the level is below. For example, here if you see that a level below 20 is deficiency, between 20 and 30 is suboptimal, and you see that again the typical supplement is 400 international unit a day, and here again same thing, that monitoring is again important. So between 400 and 800, it's your choice. And again, remember that 24 calorie formula does have some extra vitamin D too. So you don't want to overdo it. So whenever you make a choice of adding algocalciferol based on the vitamin D in neonates in first few weeks of life, make sure that you are aware of monitoring it closely and seeing that you're not overdoing it. So I hope this makes sense and you guys have learned something together today. Please do like and subscribe our channel, and you guys have a wonderful day. Bye.